Join me as I dive into the top habits that could be ruining your gut health after 40, and I'll try to turn my own around in just 1 week. As we age, our gut health becomes increasingly important, playing a critical role in our overall well-being, from boosting our immune system to influencing our mental health. Poor diet, lack of exercise, and stress can all take a toll on our gut health after 40. Many of us lead busy lives, grabbing food on the go, which often means relying on processed and high-sugar foods that can be detrimental to our gut. Our lifestyles can also lead to poor hydration, further exacerbating the issue. Lack of fiber in our diets is another common issue, as fiber is essential for feeding the good bacteria in our gut. Without enough fiber, our gut health can suffer, leading to a range of problems from bloating to digestive issues. As we get older, our metabolism slows down, making it harder to digest certain foods, which can also impact our gut health. This slower metabolism, combined with potential hormonal changes, can lead to weight gain, particularly around the midsection, putting additional pressure on our digestive system. Diet, stress, and certain medications can all contribute to gut health challenges. A diet high in processed foods and sugar can lead to an imbalance of gut bacteria, while chronic stress can cause inflammation in the gut. Certain medications, such as antibiotics, can also disrupt the balance of our gut bacteria, leading to digestive issues. Food sensitivities can also develop or worsen with age, making it essential to be mindful of how our bodies react to certain foods. Keeping a food diary can help identify any problematic foods and make necessary adjustments to our diet. Stress management is also crucial for maintaining good gut health, as stress can have a significant impact on our digestive system. Practicing stress-reducing techniques like meditation or yoga can help alleviate some of this pressure. Making significant changes to our lifestyle can be overwhelming, but one critical change we can make is to increase our intake of fermented foods, such as yogurt or sauerkraut, which are rich in probiotics. These foods can help restore the balance of our gut bacteria, leading to improved digestion and overall health. Incorporating more fiber-rich foods into our diets is also essential, including fruits, vegetables, and whole grains. Drinking plenty of water is also vital for maintaining good gut health, as it helps prevent constipation and keeps our digestive system functioning smoothly. Eating smaller, more frequent meals can also help take the pressure off our digestive system, reducing symptoms of bloating and discomfort. This approach can also help manage blood sugar levels and support weight loss. By making these simple yet effective changes, we can significantly improve our gut health, even after 40. It's all about making sustainable lifestyle choices that support our overall well-being. In summary, maintaining good gut health after 40 requires attention to our diet, stress levels, and lifestyle habits. By being mindful of these factors and making a few key changes, we can take control of our gut health and support our overall well-being. If you've struggled with gut health issues, share your experiences and any tips that have worked for you in the comments below, and don't forget to check out my next video where I'll be exploring more topics on health and wellness.